know, it's been said many times, and I really don't know who said it first, but it's been said that we are not human beings put here having a spiritual experience. We are spiritual beings who are put here to have a human experience. Now, either way, if we are human beings here having a spiritual experience, we won't have that experience if we don't take care of our bodies. If we are spiritual beings put here to have a human experience, we are charged with the duty of taking care of that host.
Well, first, what we see on television and what we are taught in medical school is that the body absolutely cannot heal itself, that the doctor is absolutely essential and no one can live without a doctor. So the body requires the intervention, regular intervention of diagnostic tests, drugs, surgery, and radiation, and that the individual patient is helpless. And what I've done over a period of years in my practice was to let patients know that the power really is in their hands and let them know what they can do to improve their health.
What we have now at the legal level is tremendous opposition to what this fine group of people and others around the world are doing, and that is I'm going to use the word in general terms, drug companies, American Medical Association, American Dental Association, insurance companies want to regulate our health care, ergo our health and our choice, which is of course inappropriate at every possible level. What we need to do is resurrect ourselves as individuals, and we need to support the people such as Dr. Daniels and each one of these gentlemen surrounding me to my left and right and around the country and around the world to continue to be able to deliver choice to us in our own health care.
Right. Thank you.
All healing comes from the heart, and that we really are motivated for the patient's well-being and as deep a level as we can be, and compassion is the hallmark of what we all must feel to do this job properly. And so that compassion has to extend to ways that we can let people know what is the true basis of health. Very, very toxic world, and we're in a perfect osmotic gradient with all the toxins that are and the pollutants that are in our environment, from the plastics and the phthalates and the styrenes and the volatile organic hydrocarbons, which, you know, benzenes, toluenes, xylenes, all the pesticides that are out there, and you know, as well as the heavy metals and the mercuries and the leads. So these things weigh on everybody. And you know, what we like to say, you don't get cancer, you know, on a doorknob.
Right.
You know, there's a reason why cancer takes hold in people, and there's genetic propensity, stress is a problem, but environmental toxicity, of course, plays a huge part in who gets cancer and who doesn't.
Having done this for as long as Dr. Gerber and I have done, we have been both attacked, both by the state of California, but attacked for our position and for being at odds with the traditional methodologies. So we have a lot of empathy for Dr. Daniels, who's going through that right now. And this, these attacks, as Dennis mentioned, I think they do indicate some level of success on our part, that we're being attacked more vigorously and more viciously.
My background is actually in family medicine and neuromuscular medicine, and actually I'm just only 3 years out of my training, so I still suffer from some of the brainwashing that was, you know, done to me during the process of training to be a physician. Yeah, so to be honest with you, a lot of things that I involved myself in, I took with a big grain of salt initially, because my concern was, well, you know, I don't know about all this stuff. I didn't learn about it in medical school. I didn't read about it in textbooks. So is it really true? Is it really working for patients? And it wasn't really until I spent time with Dr. Gerber and then subsequently Dr. Brody that my eyes got really big when I see all these people who were either being sent home to die, were told there's nothing to do about this malady or this illness, and now suddenly they're getting relief.
Prozac and Lexapro and Paxil and cholesterol in statin drugs that lower cholesterol. Those are just making billions of dollars for the drug industry. And when we learn how to eat in accordance to our genetic requirements, because there's no drug that will ever make up for a nutrient deficiency to our genes.
Hormone, which may increase potassium. Therefore, you should not take Yasmin if you have kidney, liver, or adrenal disease, because this could cause serious heart and health problems. If you take medication for cardiovascular or inflammatory disease, have your potassium level checked in the first month of taking Yasmin. The pill does not protect against HIV or sexually transmitted diseases. Women, especially over 35, should not smoke. Serious risks include blood clots, stroke, and heart attack.
Ask your doctor
For
about
people with liver or kidney problems. In rare cases, serious side effects in the liver or serious skin reactions have occurred, so your doctor may do a simple blood test. Other side effects, including headache, diarrhea, indigestion, and rash, were generally mild. Ask your doctor about.
Do you hear this? Have you heard this and listened to the words of what's going to happen? Short of some appendage falling off, everything else was in there for taking pharmaceutical drugs.
Because in medical school, we were taught that even though there are these dire warnings in the PDR, physician's desk reference, that they really didn't mean anything and that patients should take these things, we should prescribe them freely. But recent statistics have been revealed that 107,000 people a year who are hospitalized die from properly prescribed medications. That means the doctor got the right diagnosis, the right drug, the right concentration, and gave it to the patient, both expecting the patient would get better, and the patient died and went home in a pine box.
Not only are patients being victimized with the toxicity, but I have here a publication, and I'm reading some of the markups of pharmaceutical drugs, some of the well-known ones like Celebrex. The cost of a generic of the active ingredient per 100 tablets is 60 cents, and the consumer price is $130, which is a markup of 21,000%. Now that goes all the way to Xanax, which is for 100 tablets, the generic active ingredient cost is 2 cents, and the consumer price for 100 tablets is $136, which is an obscene markup. It's over 500,000%.
One of the most disturbing things that I see in our culture, in medicine, and in most of all in my profession, the legal profession, is a complete failure to remember what we're supposed to be doing.
I've already mentioned that those profits were obscene, that paying 60 cents per 100 active ingredient for a tablet and selling for $136 for the same amount was obscene. What we need to do is pay attention to what happens to that difference. Where is that $135 going? It's being spent to pay off legislators to get laws passed to reduce people's choice. It's being paid to fund research at medical schools and create sympathetic experts to testify to the effectiveness of drugs when really there is no objective evidence of effectiveness. It's being used to keep people ill. And so they understand that every time they take their insurance card to the pharmacy and buy a covered prescription, that the only reason the prescription is covered is because it will keep them in a perpetual state of fear.
A statement I've ever heard, and it was from Dr. Ruza Bogdanovich. She said, there are no incurable diseases, only incurable patients.